We're going to get started. We have a really amazing mentor on for you guys tonight. I'm Danny Rabwin. I'm the founder of Ready Vet Go, which is a mentorship program for new and early career veterinarians. You all are joining us here through the Ready Vet Go community as either community members or other mentors, and welcome. I see a neighbor here chiming in from Sacramento. Hi, I'm in Benicia. I'm your neighbor. You're probably freezing and it's wet just like it is over here in Benicia. So thanks everyone for joining us. I'm going to introduce our mentor. So every month in the Ready Vet Go community, we have drop in Ask a Mentor, which is why you guys are all here. This month I am really excited to introduce Dr. Michelle Cook. She is an amazing veterinarian. She believes in practicing the full art of veterinary medicine by using evidence-based medicine and compassion to provide the best care for pets and their families. She is a graduate of The Ohio State University. After that, she went to Angel Memorial Medical Center in Boston for her internship. She went into general practice after that and became a medical director. She and her partner, who is also a veterinarian, moved to Colorado so that they could do a residency, so that the partner could do a residency program in diagnostic imaging. Michelle was a medical director there. She has also recently pursued an extra degree and earned a master's in public health at the Colorado School of Public Health, where she has an MPH in population, mental health, and well-being. And she is a mom and has two kids, and her family lives in Maine. She's held a variety of roles. I can't speak highly enough about Michelle. She's super kind and thoughtful and is a wealth of information. And so this isn't Ask Me Anything. You guys can literally ask anything. Nothing really is off limits. So I see that we have students joining us. So you can ask questions about veterinary school, life after school, or life after your master's program. And I have some questions for Michelle if you guys are wanting to hear from me. So I'm going to turn this over to Michelle, and welcome.
Thank you so much. What a warm introduction. I really appreciate that, Danny. Yeah, I think Danny summed everything up really. I'm doing my thing here in Maine. I when I went to vet school, I was like pretty sure I was gonna either be a clinical pathologist or maybe a dentist. I wasn't really sure. And I did my internship year and was like, whoa, I'm super burned out. And so it was a very intense internship, if anybody's heard of that one. And so I think my record was there was one 48-hour period where I slept for an hour and a half. That was probably my worst back to back. But anyway, after that experience, I was kind of like, I just kind of need a break. I don't want to pursue any more training at the moment. And so I naively went into veterinary medicine general practice and I was like, oh, it's going to be like great. I'll have relationships and we'll have appointments and everything will be on time and everything will be predictable. And turns out, no. But I do really love general practice. I feel like I do get to do a little bit of everything. I love being kind of a knee to thigh deep in each specialty area and helping people connect with the kind of specialty services they need if they decide to pursue that, or being like, hey, if you want to stay with us in your GP practice, we'll work through this with you. And so I feel like I get to do a little bit of everything, a bit more of a jack of all trades approach. I get to do dentistry still. I do cytologies daily. So I get to dabble in the things that I was really kind of keyed into during my training. And I currently have the best job I've ever had, and I'm so grateful. I work with just a wonderful group of people. They are in veterinary medicine for the right reasons. I'm lucky to have really wonderful clientele at this practice, and it's just been great. And I am just such a it's given me like kind of a renewed love for what we do, because every day I'm with people who love what they do and we're helping other people with their family members, and it feels like a really good fit, and I'm just full of gratitude for that. So that's kind of my random babble for this evening. But I'm curious what you guys all have on your minds, what you're thinking about, if you have any questions. I see I've got a fellow Buckeye on here, which is always exciting for me. Um, because most people are like, oh, the Ohio State. And most of us who go there don't feel that way about it. But it's still nice to see a fellow Buckeye. So nice to see you, Dr. Johnson. I know, Danny, do you want to start with questions? Do you want me to
Yeah,
throw
I
it to
love
the
this. Thank
group?
you so much. I love to hear that you're at this place now where you are in a place where you say they're doing things for the right reason and that you have joy and
So much joy.
this
Yeah.
yeah, this is, we really bring on mentors into our program who love this profession. And, if there's anybody listening who is having some challenges or struggles, I think Dr. Michelle is going to be a really great person to talk to. So really, this is anything really, like clinical cases that you're having trouble with, sort of like managing family and life and all of that. I'm going to just open it up. We are a small group tonight. So please feel free to come off mute and just put your voice into the room if you would be so brave, or feel free to drop your questions into the chat.
I can also tell you about my master's in public health if you want to hear about that too.
Yeah,
I don't know if that's this audience, but
I think the people who are here are definitely going to want to hear many things about you. And I know that sometimes it's a little bit challenging or scary to be the first one to ask a question. I do see some things coming into the chat. Somebody's interested in hearing about the MPH journey. So why don't we start with that?
Okay, cool. So I decided to go and get my master's of public health in 2019. I'd been toying with the idea for a little bit. I was, as Danny mentioned, I was in Fort Collins, Colorado. My partner, he was finishing up his residency in diagnostic imaging at CSU. And I just was really feeling a little bit burned out by my role. I was a medical director and a GP. And it was the kind of situation where there was a lot of turnover at this particular practice. And at one point, I was the only full time vet working it was a four doctor practice. And I was the only one there full time. And I was doing all the surgeries, all the dentistries. Other people were coming in to do relief shifts, but it was super, super overwhelming. And I started to feel burned out, to be honest. And not just like my internship burnout was different because I knew that was a set year of, it was really more exhaustion, I felt at that point. But I was really starting to feel like my little fire inside for doing what I love to do was starting to really get extinguished and suffocate a little bit. And I just started kind of cruising around the CSU website and found their master's in public health program. And there's a particular subspecialty in the MPH called Animals, People, and the Environment. And my bachelor's degree is actually in environmental science and biology. So I was like, "Ooh, this could be a really cool combination." And so I started looking into that. And as I kind of continued to do some research on that program, I came across a new program in the MPH program that was population mental health and well-being. And I was like, oh, that's interesting. Because as you know, our field has some published studies that show that we have higher rates of suicidal ideation, especially if you're a female veterinarian. And personally, I've seen some practice cultures that just chew people up, and I was like, whoa, wouldn't it be cool if I could take my experience as a practicing vet, learn this information about population mental health and well-being, and kind of marry the two pieces and do things to actually improve our mental health status as a profession. And so that was my like intention going in. And of course, you get into anything and you realize like, oh my gosh, it's a rabbit hole. Um, and public health is a huge discipline. And I loved every minute of my program, and found that it was just this really cool intersection between like the science and the practice that I was familiar with, and like social justice, and just all these other areas that I feel like I'd always kind of known about, but I didn't know about. And now I feel like I have a little bit more information in that area. And I just feel like a better person after doing that program. I'm currently like trying to work with Johns Hopkins. They have a study going on right now regarding anybody working with animals and their mental health and well-being in the workplace as a result of the pandemic. And so, I'm really just kind of feel like a coffee runner, to be perfectly honest, in that study. But I do what I can to be involved with that, and hopefully do some more work with them. It's really cool. They do a lot of work with workplaces, and understanding that the workplace, you spend 8 to, as a vet, 14 hours a day, depending on where you are in that space. And so um, interventions and uh, job structure can really make a big difference in people's work experience, which allows them to have better mental health outcomes. So that kind of stuff is really where I went with my MPH. Oh, and Dr. Johnson, is it Jasiara? How do I say that? Sorry,
It's Jasiara. I did good. Yeah.
Jasiara. Okay, cool.
Mhm.
Cool. So what is it that makes my job so lovely? Oh, it has a great culture. It really and it's one of those like little synergistic things and this is going to sound crazy, but there are 3 practice owners, and they all are so different. But they balance each other out really nicely. And like, if one of them starts to go off the deep end about something, the other 2 are like, no, 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 no. And they kind of bring them back to the center. So the kind of like the core of the business is the decisions are made by people who care about everybody in that building. They want the best for the patients. They want the best for their coworkers. They want the best for their clients. And that guides their decision making. So it feels like they've got a really good ethic. And I just think my personal goals align with their goals in a really nice way. So that's, yeah. And it was like, this is a job posting. I bought a house and I was like, oh, look at this clinic up the street's hiring. And it just was like, so it was like the luckiest moment of my life when I got that job. So
Mm.
yeah, so just lucky. Thank you for joining us, Danny. Melanie asked, what's the coolest patient or case that you keep in your memories? Oh, that's tough. I guess I'll pick one that was somewhat recent. And it's nothing like medicine wise, it's kind of like an interesting little kind of puzzle. But I'm going to say that the patient and the client are really what makes the case special to me. The client she's just this lovely older woman. She has 2 Cairn Terriers, and the older one, he's about 13, and he's just this happy little guy. And he's always been PUPD, and he has this kind of intermittent facial pruritus. And so, we did some basic lab work on him, and he had an elevated total calcium. So we ran an ionized. The ionized was elevated. So I was like, okay, we got to do a full workup, because the acronym I always use is hard ions for like the list of differentials for hypercalcemia. And so the client was super on board. We did a malignancy profile. I'm not sure if all laboratories have those, but IDEXX has something called a malignancy profile that basically does a PTH, a PTHRP, ionized calcium, total calcium, and a couple of other things that I can't remember at the moment. But that all came back as like not likely to be malignancy. We did an abdominal ultrasound with a thyroid ultrasound. So my husband's a radiologist, and he was like, oh yeah, I totally can do a thyroid ultrasound. So, which, that's not a typical placed ultrasound. So anyway, he came in and he did the abdominal ultrasound, the thyroid ultrasound, didn't really find anything except for a couple of little nodules in the neck and on the thyroid. It is really convenient. I'm not going to lie. I called him the other day and I was like, hey, I've got this chest x-ray. It looks a little sketchy. And he was like, oh, no, it's not in failure. You're fine. But I also supported him financially, emotionally, and mentally through his residency. So it's my payback. Um, and so anyway, the thyroid, the parathyroid gland had a couple of little nodules on it, and we were like, oh, this could be something. It might not be. And then his clinical signs just like kind of improved. We're like, well, let's just recheck his labs. And his ionized calcium had normalized. Nothing had changed. We hadn't done any treatment on him. And 6 months later, he gets pruritic again. He's like rubbing his face on the carpet. He's PUPD again. We check his ionized, it's elevated again. We're like, all right, let's just recheck those little nodules on the parathyroid gland. Well, there were a couple more. They were like marginally bigger, but like nothing major. And then the signs went away again. And so now we're in this place, like kind of just waiting and seeing, because if we were going to go in and do a parathyroidectomy, I'd want her to have a consult with an internal medicine specialist. I'd want her to like, really understand that if you do surgically remove those things, the patient needs to be in the hospital until the calcium is stabilized, until they get the supplement dialed down. Like it could be really expensive. And so it's just kind of this interesting tinker case for me. Like I feel like I just kind of keep checking the values and, monitoring things. But I don't have an answer. And so that's kind of an interesting one for me recently. So yeah, it's a weird one. Yeah.
That does sound very weird.
It's super
Especially
weird.
because you don't have a reason as to why it keeps coming back and going away.
Nothing. His kidneys are great. His kidneys look great
Mm.
on ultrasound. They're, the kidney values are great. He has no evidence of malignancy anywhere. We've done like chest x-rays, I check it. I do a rectal exam every time the dog comes in. I don't find any masses in the perineal area at all. Like it's just, there's nothing.
Wait,
So
so weird.
it's so weird. And, I actually, does anybody know Dr. Chu? Jesse Ara, he used to be an internist at Ohio State. And he's like 7 feet tall and about this big around. And he's like super into kidneys and calcium. And I even reached out to him and I was like, Dr. Chu. It's like, what is going on? And he's like, that's weird. I have no idea. So yeah.
Crazy.
Yeah. Yeah. So the diet history, that's a great point, Melanie. This dog is supposedly eating Royal Canin, like it used to be called Senior Consult. I forget what they call it now, but he's supposed to be eating the Royal Canin senior diet. Now, what's actually happening, I don't know. Because, that it's an older couple and the husband is undergoing chemo and I think they've got a lot of people coming in and out of the house. So who knows what this dog is getting into. But it reminds me of another random calcium case. Yeah. I just wonder, I do wonder if that's the case too. But I mean, you'd think that like between the GI tract and the kidneys and the parathyroid gland, it would still regulate it regardless of what the dog's eating. So it's just like something's up and I just can't figure out what it is. But my other calcium case was a cat. And this cat came in, and this was when I was living in Oregon. I was in the Pacific Northwest where the sun doesn't shine that much. And so everyone takes vitamin D supplements. And this family used to keep a bowl of vitamin D supplements on their counter and like people would just like pop them as they walked by, apparently. Which doesn't seem like the right choice to me. But anyway, that's what they did. And they're like, yeah, sometimes the cat gets on the counter and eats them. And I was like, oh, okay, let's not do that. Like we could cause some problems. The cat came in a week later in like full on seizure. Its calcium was like in the toilet. Like it just like the cat just was having seizures because it was hypocalcemic. And when we did, yeah, exactly. When we did lab work on it, we did a parathyroid gland test, and this cat had no parathyroid function. Like it was just toast. So I don't know if it was like iatrogenic, if because this cat was taking so much vitamin D, it like burned out its parathyroid gland. I don't know. Or if it was like, or this is the other thing that would be kind of interesting. Or did it have hypoparathyroidism and it was treating itself with the vitamin D supplements? I don't know. I also called Dr. Chu on that one, and he's like, I don't know, that's weird. So anyway, I felt guilty because I was like, don't feed the cat the vitamin D, and then it started seizuring. I was like, oh shoot. It's great. The cat's great now. Or at least it was last time I saw it, which was like a couple of years ago, but yeah, it was so weird. They just put it on calcitriol and like a very low dose of vitamin D. So no, it was a weird one. And cats are crazy. I love them. I'm a cat person. I'm actually a dog person too, but I love me some cats.
And are you
Although-
just
Go
small
ahead.
animal? Are you just
Yeah,
small
I
animal?
just do small animal. I had big dreams of wanting to be a mixed animal practitioner when I first went to vet school. And then I was like, oh my gosh, there's too much information. I can't. Yeah. And then someone was like, oh, the lifestyle is also really hard. And I was like, oh, I can see that.
Yeah.
Yep. And I also met people in vet school whose parents were mixed animal practitioners. And like, they like missed the birth of their children and stuff. So I was like, yeah, it's not the lifestyle I want.
Mm.
Oh, Melanie, great question. So I got my degree in Ohio. I actually never practiced in Ohio because the day of graduation was the day that I had to be at Angel in Massachusetts to start my internship. So I missed graduation, drove to Massachusetts. So I practiced in Boston for a year. And then we decided to move to Oregon. So I was in Oregon for 5 years. And that's when I had both my kids. And that's when John decided to go back and do a residency. And he was lucky enough to get into one because it's like, I think there are 80 positions total for residents. So there are like 20 positions every year, 30 positions every year. It's crazy. Anyway, so he managed to get into a program. So we moved to Colorado, which was great for us, a really good match culturally and outdoors wise for us. So we were there for a little bit over 5 years. And then we did a crazy spreadsheet that had like, we listed every region of the country we'd consider living in. And then we listed all of our priority, like, so on the x-axis, no, the y-axis was all of the regions. And we broke some down to like, city even. And then across the top, we had all of our priorities. So we had like proximity to an international airport, family and friends, water security. Like we had a whole bunch of stuff that we thought were important, like 52 things. And then we did a bunch of research on the different locations and entered in all the data, crunched the numbers, and we ended up with what we knew anyway, which was Oregon, Vermont, and Maine were our top 3. And we invited my parents to live with us, and they were like, we don't want to live on the West Coast. And we're like, okay. So it was Maine and Vermont, and we found a house in Maine first, which is good because it's closer to cultural centers, to be honest. Vermont's pretty out there. So, yep. So I think I practiced in 4 states, but I've lived in a bunch.
Do you have a favorite state where you practiced?
Favorite state where I practiced. That's a tough question because I love my current practice so much that I would have to say it's the best practice I've been at. But I don't think that that's because I'm in Maine. I think it's just like where I landed in particular. In terms of like state boards and rules and things like that, I really did like the Oregon board. I thought they were like proactive and still practical, while it felt like in Colorado, everybody was terrified of the board. It's like no one wanted to be called to the board because the board was just mean in Colorado, is what everybody told me. I never got called in front of the board, so I don't know, but I was like, ooh, I want to avoid that. Melanie, where did you practice in Maine? York. Okay, yeah. Yeah, I'm not familiar with really anything outside of where I live. It was special. I mean, I'm not surprised. There's some, I love Maine, but sometimes I'm like, wow, guys, what is happening here? Anybody have any like work-life balance questions or yeah? Hit me up.
I'm working on my question, so but it's taking a bit to form it. So maybe I'll just start reading where I'm at right now.
Yeah.
Okay, so I'm an Ohio State grad as well, and I graduated in
Congrats.
2017.
Mhm.
And I'm actually having the opportunity to start a new practice. It's set to
Mm.
open this March. But I'm also, a working mom with a 12-week-old and a
Oh my
4-year-old.
gosh,
Yes.
congratulations.
Thank you. Thank you. This last one was a blessing because I did have a loss the year before. So
Oh, I'm so
extremely,
sorry.
extremely excited to be with her. But also a little scared of this whole new process of ownership. It's my first time.
Yeah.
Um, imposter syndrome is really kicking in right now because you got the
Oh.
the baby hormones and the mom guilt all mixed in with starting a practice.
And
Um,
now you have two.
yeah, so I have two, 4-year-old who is in TK right now, who's loving it, but also bringing all the sicknesses home. So both of them are sick right now.
Hmm. Hmm.
And
Your baby's gonna have a great immune system.
that's what I hear. I heard like, kids that have siblings and then are around animals tend to have the best immune system. So I'm just,
Yes.
crossing my fingers that's what's gonna happen.
Yeah.
Um,
It's your silver lining.
yes. I do have a supportive husband. And he's in banking, finance, and business. So he was kind of the inciting force for jumping on this opportunity, despite it being kind of a weird time with me having a newborn. Um, But so my main goal is with ownership is to kind of negate some of the negative experiences I had, like you were discussing about, being burnt out, compassion fatigue, overwork, those kind of like negative systems that we kind of have in certain veterinary medicine
Mm-hmm.
um, places, just eating our young in some cases.
Totally.
And so I kind of want to create that culture of positivity, like you're talking about teamwork and respect that you have at your current job as a new owner. But I also want to be realistic about, being a healthy prov- mom, and balancing all these roles. So I
Mm-hmm.
guess I think my question that I was going to ask is any tips for balancing that out, how I can implement that in my practice and make that a priority. Because that's my main goal for ownership. My husband's, yes, looking at finances and money and stuff, but that's what
Right.
I want to create.
Well, and if you do good medicine, you're gonna have a successful business, right? So like not even probably an issue. Um, I mean, my gosh, you have so much going on right now.
I know. And I'm beginning to get a little scared. I'm like, I don't know if I can
No,
handle this. I was scared at the beginning.
yeah,
But we're
you
also
got
kind of
this. Yeah,
crunch time. So that's probably why it's like
yeah,
all the
totally.
equipment, all the ordering, all the making sure the finances are in, invoices, calling vendors, and just making sure they're going to be there,
The
all
devil's
that stuff.
always in the details. My first
Mhm.
question would be, do you have a really good practice manager?
Yes.
Okay.
She has experience actually owning a mobile spay and neuter clinic. She's not a veterinarian or RVT, but has been in the field for 25 years,
Okay.
and but more in the rescue industry area.
Mm-hmm.
So I do. Yes.
Okay. Awesome. Yeah. I mean, so I would say, and I've never owned a business before, so full disclosure, I'm the ideas I have for you are just more kind of general things. But I feel like in leadership roles, I found myself getting the most burned out when I felt responsible for everything that happened in those four walls. And, um, part of it was that I didn't have a hospital manager to partner with really for a long time. And part of it was that I have a tendency to take on more than I should. So full disclosure, I had to work with a therapist for a long time to like let go of some of that stuff. But I think if you have somebody you truly trust and you can hand over like the calling the vendors and that kind of like that peripheral stuff, that's gonna save your bacon. And then just as like a mom working in a caring profession, um, and I don't mean this in the like get yourself a manicure kind of way, but self-care is going to be so huge for you because you won't be able to pour from an empty cup, you know what I mean? So, even if you find, I'm listening to a meditation book right now. I find that if I listen to like audiobooks, I can get a bunch of stuff done and still feel like I learned things. I'm reading, his name is John Kabat-Zinn. He's from Massachusetts and he has a Massachusetts accent. So that turns like half the population off right away. But he says such amazing things about like finding like just meditation in moments. Like just as you're doing your day, if you can just be like really conscious of your inhalation and exhalation, even as you're doing stuff, that's going to help you like reset your center. And yeah, I've just been really like enjoying his stuff lately. And it seems like with the whirlwind you have at home and about to be at work, that seems like that might be really important. I don't know if that's helpful at all. Hey, do you have a good mentor who owns a business?
Um, I guess yes and no. I've kind of
Mhm.
been, more of a hermit since being on maternity leave with the baby, but I have a high school mentor who owned, and then I've met a few through like our medical association.
Okay,
Um, so I've
good.
asked general things, but
Yeah. Is there anybody that you really feel like you connect with?
like in regard to like owning or as a
Hmm.
veterinarian.
Yeah, like a veterinary practice owner, especially like if you could find somebody who's like a mom who owns her own practice, I feel like who you like connect with, I feel like just having a relationship with that person can be so helpful.
I actually do, but I just met her. So like I
That's
was doing
okay.
relief for right
Yeah.
towards the end of my pregnancy, and I just met her and I really liked her ethic. Although she did have like I guess a father who owned veterinary practices, so she learned through him and such.
Even better. Even better
But
if she
so
can
far,
pass
like
that
I've only
knowledge
known her a
on to
month, so I'm
you.
like, can I pick your brain even though I've only known you for like a month?
Yes.
Like,
You should have like a monthly coffee or tea date or something with her. Or like bi-monthly, you know what I mean? And
yeah.
like Melanie said, like scheduling self-care, but schedule a little bit of time where you can just like be like, man, I've got an employee that I need, like, I don't know what to do with this. Um,
Hmm.
and you know, when I was in a leadership position, I had a couple of really tough situations, and have a friend in HR, and I'd be like, "Hey, Jackie, I need your opinion on this," and she would walk me through that. And then I had another friend who was like really good at business management. I would call them on those things. So even if you don't have like one person, but having like different people who like can help you through those sticky situations who you really trust, I feel like that's
Hmm.
huge too. I don't
Okay.
know. I don't know. I'm super impressed by you.
I know. I know it's hard to like to kind of to give tips and stuff because it depends on your whole
It's so
lifestyle. But
much.
I know with your background and the
Yeah.
public health and the mental wellness, I wanted to see what things have worked for you, what you've seen in the
Oh,
practices that
yeah,
have
yeah. Oh, I
operated
see.
well.
Yeah.
You know what I
So in
mean?
I do. So in terms of like how you can set your business up for good mental health outcomes, um, what the data we have say is really that a lot of this is leadership driven. So you have to practice what you're preaching. So if you're like, everyone has to take their lunch break, you got to take your lunch break. And like that means like maybe turning a card over on your door, being like, hey, 30-minute lunch break, or hey, pumping break. Like I like that's my clear boundary. So demonstrating respect for your own boundaries will give everybody on your team the impetus to respect their own boundaries and to be, healthy about that. Um, also, I would say work design is super important for mental well-being. And what people want is they want to have a little bit of control over decisions and how they do their work. So, um, that's going to vary hugely from one department to the next. But, I guess I would say I think a lot of people tend to have like such tight lines around how a CSR needs to answer the phone and how they need to schedule an appointment and da 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 da. But if you give them a little bit of leeway, and especially the autonomy to make certain decisions on their own, like, hey, I know we don't have like any urgent appointments left, but this, client has an ear infection, they're going out of town, they're really upset, can they get in? Like I scheduled them and being like, okay, cool, I respect that decision you made. Like those little micro moments of kind of reinforcing that they can make decisions, I think is huge because one, then they're not going to come to you for everything. And two, they're going to feel like they've got control over what's happening in their daily life. And that's autonomy is one of the number one things that kind of consistently bubbles up with workplace well-being. Then there's a whole bunch of other stuff like, most of the programs that try to promote health and well-being, like the blood pressure reduction programs, blah, 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 blah. Unfortunately, they're not super effective. So I would say don't waste your resources on those in terms of like where to put your time and energy. And I would also say if you have the right kind of structure for it, involving people in the decision making that affects how they do their job is so big, and it will make them feel so respected and valued. Um, and just like listening to them, and you can be like, hey, listen, I have to make the final decision about this with all of the information gathered, but like your perspective is important to me. Even that in itself is, I think, gold for most employees. Is that more along the lines of what you meant? Um,
Yeah,
yeah. I did and wait, Jessiara, where are you located?
I'm in Sacramento, California.
Sacramento. Okay, that's right. Okay. I'll look and see if there is a program near you, but the NIOSH, which is it's actually a branch of the CDC, they do a lot of workplace interventions, and in some states and in some regions, they have um, a workplace center that they'll come in and they'll like assess and help you like figure out where you can like make changes and which programs might be helpful for your team for workplace well-being in both the mental health space and in like the safety and wellness space. So the thing to look for would be like a total worker health is what the term is called. So
Okay,
yeah, some human practices. Yeah.
thank
Reach
you.
out to Tori. She's got some RVG folks who own practices. I think that's going to be your jam. You got to get somebody who's been in that situation,
Mm-hmm.
Mm-hmm. NAMV is called Clear Blueprint. That's practice wellness certification. Yeah, I'm not familiar with that particular program. It sounds like Melanie might have some information about that too. But yeah, autonomy and control are your two things. And I think that's why I feel so valued in my workplace is I really feel like I, as an individual, am respected. I've worked at places where I felt like I was just like a workhorse, or like I had one boss tell me once, well, I don't even think veterinarians should take lunch breaks. Yeah. And it's the same practice where I was like, I'm feeling kind of like really overworked. Can I have 2 days off in a row? And they laughed at me and said, no. And this was not my internship. Yeah. So don't do that.
That's
Yeah. But if people feel valued, that's, I think, huge. Were there any other specific things you were concerned about in terms of like creating culture? No.
Well, I've joined a few groups just like this for management guidance in these scenarios. So I'm part of this. I'm part of Vet Circle, which is based in Canada, and like the Andy Rourke management group as well. All new to me, but I just knew I needed resources. Potentially delved into a never-ending rabbit hole, but it's there when I need it. But
Yeah.
the Vet Circle one talked about how operations can be very key for making life easier for the doctors and really utilizing your staff and their role and what
Yes.
role they're supposed to do instead of them having to wear so many hats that they're not feeling fulfilled in either whatever license they have or their goals for the future, etc. Or I'm too busy restraining to actually do diagnostic things. So they said that's like a really big key for that. And so I think integrating that operations thing with the autonomy without being too free flowing for making decisions in the practice.
Yeah.
That kind of is my goal.
Yeah.
And I
Everybody
guess
needs
it's the
guardrails,
right
but
way
yeah.
to do things, but I do want a realistic way for me as a mother to try to do this where I can still carve out the right time for my kids and the same for all my staff as well.
Absolutely. Yeah. That makes sense. And I mean, it seems like anytime you undertake a new thing like this, just in general as humans, we have like fits and starts, right? Like,
Mhm.
and so much of it is getting the right person in. Having the right team makes such a big difference, and then keeping them there. But that's all of those pieces. Because if you operationalize everything correctly, you've got the right structure in place. You've got people doing, the right job at the right time, and they feel like they can make decisions within their area. Like, yeah, that's the dream right there.
For the group, has there been any really big no-nos that you guys have seen with owners that you're just like,
Mm.
wow, that really turned me off right away? I definitely saw the lunch break thing. Yes, I think that's a big one. Although I do get some workaholics that are like, oh no, I can do that. I'll just, punch out and then, finish this task.
Mhm.
But anybody in the group?
Oh no,
Oh,
Melanie, what
oh wow.
happened?
Oh, well, that was back in Maine. That that was my first job out, and it was just there was a lot of bad things, but I was expected to do a lot of things that were not okay. And when I left that job, I actually had to hire an attorney to basically send a cease and desist, because when they fired me, they locked me in a room until they had me sign a piece of paper that said I quit. And then after I left, like the guy went and locked up all of the records because he thought staff was stealing them to give them to me. And then he was telling people that I killed their pets, and I had never seen the animals. Like, it was just, don't do that. Just don't do that.
God,
Wow.
Yeah,
that's
it was a
epic.
poor experience. It did not last long, but it shaped me into who I do not want to be as a veterinarian. And I mean, that was almost 20 years ago, and it still affects me. So
Yeah,
don't do those
That's
things.
traumatic. Yeah,
I was
I'm
gonna
so
say
glad
that's
you're still here and willing to be
Yeah,
a veterinarian because could definitely just end a career in some cases. So
mhm.
it was a ER practice, and I was left alone my fourth day, 4th of July weekend in southern Maine, which is total tourist area.
Yeah.
And that was actually the first time I had a client tell me to kill myself. So that was fun.
What? See,
Yeah.
this is
Got
this is
mauled
what I'm
by a
talking about. Like, that's
ferret another
crazy. That's
day.
not. Yeah.
Yeah. Didn't let me go to the doctor until after my 12-hour shift was over. Because who gets mauled by a ferret? That was just ridiculous. But anyway, it was it was quite the 6 months of my life.
Oh.
So,
And you were fresh out of vet school?
Yeah, yeah, first job. It was a lot.
Seriously, it's like eating our young and just breaking some of these old habits. It's like you can get amazing mentors, but at the same time, you get also this old school way of thinking sometimes
Yeah.
that can be detrimental to what we're dealing with now. I mean, the majority of us are women. A lot of us have families, or, you
Mhm.
know, a lot of us have loans now where we have to price our work accordingly. We can't, cut corners in some ways just to even if we really want to be compassionate for pets and their clients, can't afford to. So
Yeah.
mm,
Well, and like we
that's
don't ask that
another level
of
of leadership issues.
human.
Sorry.
It's crazy. It's hard. And, I
Yeah.
think we are practicing now at a time of great change in our profession. And I
Mhm.
feel like, we have that kind of backhanded blessing of living in interesting times.
Mhm.
I mean, in the broader world and also like with what we do, like things have just changed so much. I mean, specialty medicine was not a thing 20 years ago, right? And now it's very much a thing.
It's definitely more reflective, like human medicine now. Let's prefer for
Mhm,
this, prefer for that.
mhm. For better and worse, man.
This insurance is coming up a little bit too now. Still not as
Mhm.
popular, but
Yeah. Yeah. It's kind of wild.
I know
Well,
one thing that I felt was like I've never worked as a vet, never owned anything, but from like a reception standpoint or just being a assistant groomer, one of the things that was really hard for me to deal with in one of my practices was our practice manager not listening. This was corporate, so you have that you're owning your own practice, so you can dictate what happens a lot better. But our practice manager uh, really wasn't listening to us. We
mm,
were all very burnt out as far as the schedule went. And we actually collaborated together as a team outside of our practice manager to come up with an optimal schedule where all shifts are covered, but everybody got their time off and their breaks when they needed and all of that was working. And she just kind of like looked at it and like laughed and threw it away, basically.
oh,
Um, and that was my breaking point. I ended up meeting my husband and getting married, so that's how I got to leave. But um, I was at the point when that happened. I was very much like, okay, well, there's no point in me staying here if I feel like I've exhausted all of my options in how I'm trying to manage, my life. Because I was at this practice, I was a groomer, a receptionist, and a vet assistant, and so I basically did, yeah,
yeah,
I
it's
did
a lot.
grooming. It was I did grooming on my days off of reception work, and so there was one Thanksgiving where I worked 2 weeks straight and didn't take a break at all. Like I didn't have a day off. I didn't. There were many times where I would groom. I would get there at like 6 in the morning and groom, then do a reception shift for 12 hours, and then come back the next day and do it all over. And I remember one of my coworkers mentioned to my our practice manager, she was like, "Tori's been here, you know, XYZ amount of time," and she was like, "Well, this is her job, so why, why is that weird?" So I say all that to say, definitely, listening to your staff, making sure that their needs are met, that they're heard, that they feel heard. Um, because that definitely goes a long way in people being willing to stay and wanting to stay and feeling appreciated. And I think that a lot of people take that for granted. Who are managers or who own practices, they just think, well, I can find someone else.
mm,
But it's special to have people who want to be there and who want to invest in the practice. Just as much as it's special to have great clients and people who want to come to you because if your clients are happy, if your staff is happy, they're gonna suggest, their family and their friends and people they may just meet off the street to come to you, right?
Mhm.
Versus someone saying, don't go there. And it not be anything to do with the care. It could just be, I don't I don't believe in this practice, so why would I invite someone to come? Even if you're the best vet in the world,
Mm. Yeah, that was my last job. Mm.
It's amazing. We all have these stories about working in a place, feeling like a resource, or like, like an item to be put on a spreadsheet rather than a human being, right? And like that's
Mhm.
just like no one wants to be treated that way. I don't know. It's really sad to me that it happens so much out there. Thank you for sharing that, Tori. Melanie, did you want to add something?
Yeah, I was just gonna say that, so I do relief now, and it's been almost 10 years that I've done relief, and I have learned so much from various practices and what works and what doesn't work. And what works in one place may not work in another. So that's always remember that you have to try different things. But one of my absolute favorite things that clinics do is, along with the autonomy, is like at Christmas time or whatever, beginning of the year, everybody gets like a bank, if you will, of money to use to help someone. So if they want to give a free nail trim, that comes out of their $200 for the year or whatever. Um, Rather than, everybody coming to you and saying, oh, this is such a hard luck case. We need to do this, we need to do that, because you become they want you to do pro bono for everything, and you can't, you're a business. But if you allocate X amount of money per year, and they are responsible for X amount of money per year that goes to someone that they can choose who the money goes to or whatever, that gives some autonomy and also um, some say, if you will, in who gets help, because they may know something that you don't or whatever. And then the other is like around holidays or whatever, where everybody gets to sit down and be like, all right, who's the person you want to fire? Like, that just is the time suck, is the soul sucker client. Now, if you keep up with that throughout the year and you're like, I don't stand for abusive behavior, you're out. Because as a new practice owner, you will be freaking out about firing people, but you are building your clientele and you want to build the people you want to have coming there. And you can do that. You can decide if you want the abusive people, then great, have them. But if you don't, you train them not to be abusive. And the practices that have done that have much happier staff. Because once again, there's some autonomy, and they know that their thoughts are respected and cared for. Because the clients will be sweet as pie to us as the doctors, but we'll treat them like trash. And the staff doesn't deserve that. Their pay grade is definitely not high enough. So paying attention to those things. And then if you haven't read the Languages of Appreciation in the Workplace, I highly recommend that. It's based on the love languages, but appropriate for the workplace. And knowing how people want to be appreciated and how you give appreciation, because if you're speaking two different languages, it's not going to work out. You both are doing the best things you can, but you're just ships just crossing in the night or hitting head on. So those are just a couple thoughts of things that I have seen that may be helpful.
I've done the 5 love languages. Actually, let me it's right on my bedside right
Oh.
now. Sorry.
Perfect, love it.
Hold on. But
So it's the
and I was
same
thinking of
owners or the same writers.
I was thinking of doing a disc profile for like, team building
Yeah.
in the workplace. Like it's like your personality in the workplace. But I've never heard of this, so I think I'll definitely include that as part of like our team bonding experience because we're totally new startup ownership. Hopefully I won't be like, too much of an owner who has like their head cut off in some ways, and they'll be understanding and give grace. But I think this would be great for
I
that.
popped in a book too. Stephen Covey, he wrote The 7 Habits of Highly Effective People. Pretty much
Mhm.
every other book out there on like business and love, like Gottman wrote a book about like he's written many books, but he's got this whole like couples therapy thing. It's basically the 7 Habits of Highly Effective People recycled. And like there are a bunch of business books out there that copy this. So I
Mhm.
always just kind of like this isn't directly applicable to like starting a business, but this is one of those things that I feel like these ideas are so good that everybody's like, oh, I'm going to apply them to this new situation and create a new book about it. So I think it's worth reading with all the time that you have. Yeah, get your headphones, put it on Audible.
No, your audiobook situation is real. I totally get that one.
Yeah, it's the only way.
Change diaper, listen to audiobook.
Yep, yep. Smile and nod at the 4-year-old.
Mhm. Well, first, Melanie, you scared me when you're like, get together end of the year and fire people. I'm like, wait, we're gonna do like a team exercise of firing people that are on the staff. But then you added on clients, and I was like, oh, okay, yes, that makes more sense. I was like,
Although on that
California is a
note,
litigious state. They probably would. I'll be on the chopping block for something after that.
on that note, you do want to hire slowly, fire quickly. Like if there's someone that does not match your
Amen.
practice, does not give you the culture that you want to propagate within your clinic, you're better off being down a person than having that person build toxicity in the practice. It sucks and nobody likes to fire anyone, but that is the fastest way to lose good employees, is to not fire bad employees. And it's not that they're bad people, they're just not a right fit for your practice.
Yeah,
So it's
I agree with
hard,
that.
but you gotta do it.
I also think if you set expectations when you hire people, so with that practice I was telling you about, where I was the manager and I was the only vet working for a 4-doctor practice for a little while. There was some staff turnover, not surprisingly, but it turned out to be a really good thing. And even when I hired like new doctors and got new staff in, I was able to set the tone for my expectations and like help them see my vision. And that was huge, helping like, because I kind of let them during the interview process decide whether they wanted to be on my team or not. I'm like, this is my ship. This is the direction we're going. This is how I see you fitting in as crew on this ship. Are you in? If you are, cool. If you're not, totally fine. I'd rather you say no now than pretend that you want to swab the deck when you just don't. So I found that made a really big difference, especially when I was hiring doctors. People appreciated clarity in that area.
Yeah.
So, well, thank you for being so vulnerable and sharing like your journey with us and asking questions. I feel like we got some good chats in about it.
Thank you. Yep, that's why I joined the group. So hopefully I can have some support in that area too. So,
Well, if there's anything I can do, let me know. I don't think that there's anything I can do, but I'm happy to like just be a listening ear. And congratulations again on your baby. I know it's so hard after having a rainbow baby. So hope you find lots of love in that moment. Yeah.
Thank you.
Yeah.
Well, hate to cut this all short because it's been a wonderful hour. It feels way too short to be our time here, but we greatly appreciate you, Michelle, for taking this time out to share a little more about your life and your journey in vet med, and Melanie as well. Michelle and Melanie are both mentors with us for RVG and are doing a wonderful job. Melanie gets to start our winter cohort in March, so we're looking forward to all the wonderful insight that I know she'll share with our group.
Yay.
And if you guys are interested in, having more of these talks, if you're interested in certain topics, please let me and Danny know. We're always trying to find new and different things to bring to our RVG community. And we're open to anything that would help your journey in vet med and help make it more enjoyable for you for the long run.